Those patients who have a metallic valve and some patients who have a tissue valve are prescribed oral anticoagulants. And these patients are advised lot of restrictions. That is why it is a matter of lot of worry and lot of query. People have lot of questions regarding diet after a valve operation. In the last episode of Traffic Ki Pathshala, we had discussed diet which have to be taken by people who have undergone an open heart operation. So in this episode of Traffic Ki Pathshala, I am your heart surgeon, your heart specialist, Dr. Vikas Kumar Keshri. And today we will be discussing diet which has to be taken by patients who have undergone a valve operation. People who have undergone a valve operation and got a metallic valve implanted, and some patients who have undergone valve operation and got a tissue valve implanted are given a medication which is called azithromycin or warfarin. This medication acts as a blood thinning agent and makes sure that valve is functioning properly. Vitamin K acts as an antidote for this medication. That means anything which is rich in vitamin K will inhibit the action of these medications. So that is the reason people have been advised lot of restrictions. So whenever you are taking food, you should not consume substances which are rich in vitamin K. The very important part is these things are not totally prohibited for you. These things should be taken in moderate and consistent amount. The main important point is moderation and consistency. The amount of these substances should not fluctuate too much in your diet. For example, right now Navaratri are coming. So some people who take a mixed diet or a non-vegetarian diet, they shift to a completely vegetarian diet. This is a drastic change in food habit and it changes the amount of vitamin K present in your food drastically. So that is why these people have problems when diet is changed. So whenever you are changing your diet drastically, like you are planning to shift from a totally vegetarian diet to non-vegetarian diet, or you are planning to increase or decrease the amount of fruits and green leafy vegetables in your substances, or you are planning to follow a weight loss diet or some specific diet, you are supposed to inform your surgeon that you are changing your diet, and this will also mean that you will require to do the PT-INR test more frequently. What is PT-INR test? I will discuss in another video in detail. In short, it is the test which is seen to see the effect of anticoagulants. Same way, there are some medications which increase or decrease the metabolism of azithromycin or warfarin, which are the oral anticoagulants. So that is why when food rich in these substances is taken, the effect of these medications becomes less and it creates problem. So those medications or supplements are also prohibited for people who are on oral anticoagulants. So the list is very long. That is why I have made a list so that nothing is missed. I have divided this discussion into three parts. First part, I will be discussing the substances very high in vitamin K and which you should take in very limited and consistent amount. In second part, we will be discussing substances which you can take in moderate and consistent amount. And in third part, I will discuss the substances which you can take in unlimited amounts. So let us first see the big list, the substances which are rich in vitamin K or which cause problem with metabolism of azithromycin and warfarin, and that is why you should take them in minuscule amounts and consistent amounts. These substances are mainly green leafy vegetables, among which we have spinach, mustard greens, coriander leaves, fenugreek leaves, cauliflower, cabbage, green capsicum, broccoli, the mint leaves, green peas, curry leaves, spring onion leaves. These substances are rich in vitamin K and they should be taken in a very small amount and a consistent amount. Same way, some English fruits and vegetables, lettuce, kale, collard greens, and Brussels sprout. These are also rich in vitamin K. They should be taken in small and consistent amounts. There are some fruit juices which are rich in vitamin K. They are grapefruit juice, pomegranate juice, cranberry juice, and all the detox juices which are present in the market. These should be taken in small and consistent amounts. The oils which you can use for cooking your food are the soybean oil, sarson or mustard oil, olive oil, and rapeseed oil. These oils are otherwise considered healthy oils which can be taken by people who have undergone an open heart operation. But those people who are on azithromycin or warfarin, they should take these in very small amounts because they are rich in vitamin K. All the vitamin supplements, all the energy supplements, all the food supplements, and all the energy drinks, their composition is not consistent. They often contain high amount of vitamin K. So that is why if you have undergone a metallic valve replacement and if you are on azithromycin or warfarin, you should not take these supplements in large quantities. Now we will see those substances which have some amount of vitamin K which can be taken in moderate and consistent amount. Again, I am telling you the word important is moderate. So these substances should be taken in moderate and consistent amount. Among the fruits, we have mangoes, plums, garlic, ginger. Among the oils, we have groundnut oil, sesame oil, sunflower oil, and the liver of the meat. These are rich in vitamin K. They should be taken in moderate and consistent amount. I have done a sin. I have brought the tea and alcohol in the same category. So green tea and alcohol both cause problem with metabolism of the acetylcholine and warfarin. So they should be taken in very small amount. Otherwise also alcohol is not good for heart. It should not be taken. Then comes some energy drinks or supplements which are taken commonly by people. That is soy milk, aloe vera, ginseng and ginkgo biloba. These substances should be taken in very small amounts because they cause either problem with metabolism of warfarin and acetylcholine or have higher amount of vitamin K. Some proprietary medications which are available in market. One is fever flu, which is sold in the name quinine. Another is St. John's wort, used by our dermatology friends. Another supplement is chondroitin sulfate, which is very commonly used by orthopedicians for patients with osteoarthritis, and commonly used omega-3 fatty acid supplements. These also are either rich in vitamin K or cause problem with metabolism of acetylcholine and warfarin. So that is why they should be taken in moderate and consistent amount, because they can cause problem with your PT-NR test. Now comes the list of those substances which can be taken in unlimited quantity. Here one important rider is that some of the substances are mentioned that they can be taken in unlimited quantity, but this is with respect to their effect on the medication acetylcholine and warfarin. I request you to see my previous video in which I have explained the substances which are taken and not taken after an open heart surgery. If some substance has been told not to be taken after an open heart surgery, that applies to you also, even if that substance is present in this list, because this list is for those substances which cause problem with acetylcholine or warfarin. So things which you can take in unlimited amount and without any problem on acetylcholine or warfarin or PT-NR test are carrot, radish, cucumber, tomatoes, potato, onion, eggplant or brinjal, corn. Some green vegetables which are green but do not cause problem are bottle gourd, ridge gourd, smooth gourd and pumpkin. In Hindi they are called lauki, tori, turai and kaddu. These are green vegetables, still they can be taken. Among the fruits, apples, watermelon, strawberry and pineapple, they can be taken without any problem. All the juicy fruits like oranges, mossambi, lemon and berries, they can be taken in unlimited quantity because they do not cause problem with warfarin and acetylcholine. All the milk and milk products can be taken without any restriction. So milk, curd, paneer and buttermilk, those things you can take without any inhibition if you have undergone a valve operation. Among the oils which you can use for cooking the food without any restriction are coconut oil, palm oil, ghee and butter. Now ghee and butter I have told you not to take in large quantities, they cause problem otherwise. By mentioning ghee and butter here, I mean they do not cause problem with acetylcholine and warfarin. All the non-vegetarian foods like egg, chicken, mutton, they can be taken in regular quantities. They do not have any problem with the metabolism of acetylcholine or warfarin or do not have any high amount of vitamin K. So in short, we have seen what are the substances which should be taken in very small and consistent amount, substances which should be taken in moderate and consistent amount, and substances which can be taken in unlimited amount. I hope I have answered all your queries regarding the diet after a valve operation. If still there are some questions, you can ask me in the comment section. I will try to answer them. If you want to learn more about heart diseases, I request you to follow my series Traffic Ki Pathshala and subscribe. Till the next episode of Traffic Ki Pathshala, seeking your permission, your heart surgeon, your heart specialist, Dr. Vikas Kumar Kesri. Stay tuned, stay connected, stay healthy. Thank you.